Hey guys, I know it's been a while since I've posted any videos. I've just not had an easy time of it. I've been really exhausted. The anemia has really gotten to me. I think my last hematocrit was down into the 20s. So when that happens, you get short of breath with every little movement. Can't do much, and for me that's been really difficult. I'm not one to sit around watching TV all day, never have been. So I was having a little bit of a pity party for myself, which is okay. It's all right to feel sorry for yourself every once in a while, as long as you snap out of it eventually, which I have. So I'll probably look crazy. I just got done working out for the first time since all of this started, so I'm trying to just get back in shape. I have 3 more chemotherapy infusions with the Taxol. The first one I had 2 weeks ago was really tough. I ended up having what only like 35% of patients that get Taxol have, is an acute pain syndrome where had hyperarthralgia, which is where I have pain in almost every joint in my body. I mean, even my jaw was hurting, my fingers, my toes, every long bone was painful. And then on top of that, I had bladder spasms because my bladder was irritated by the medication going through my body, and every pelvic floor muscle was having spasms. So it was kind of like going through childbirth, except with bone pain on top of everything. It really felt like I was having childbirth again, and it sucked. The doctor had told me that to expect some bone pain and to just treat it with prescription strength ibuprofen, which I did, and it did not work. And it shows up like clockwork. They said usually if it's gonna happen, it happens within 48 hours, and it did. So I was miserable. By the end of that day, I was in tears because it just would not stop hurting. I can handle pain. Being a dancer, I'm used to it. You know, you work through it, but when you've been in that kind of pain for so many hours, it just takes so much out of you. So I did get some Percocet finally. That helped tremendously. It was the only thing that helped. And as soon as it started wearing off, like right at the between 5 and 5.5 hour mark, the pain would start. And if I didn't take another pill right then, it was just unbelievable. So I have another treatment of that Thursday, and now that I know what to expect, I feel a little bit better. I'm just gonna start taking the pain medicine on that day too, so that I can just prevent it from starting in the first place. I don't really like taking a lot of pain medicine because it leaves me doped up, and it just makes me feel weird. I could never be a drug addict, so but that's behind me. I'm not hurting anymore. I'm still exhausted, but went and saw the breast surgeon, and he said that probably the week before Thanksgiving is when I'll end up having my surgery, which actually works out pretty good because then Matt was gonna take the whole week of Thanksgiving off, and the boys will be off that week too. So I started thinking like a nurse and realizing how out of shape I am and how weak I have become by not being able to do any activity. They said the anemia should level off now. It won't get better while I'm on the Taxol, but it won't get any worse either. So I'm hoping that will give me the strength to get through some of these workouts. I did some light weightlifting today just to try to get my muscles back in shape, and it was tough. I've never used weights that light before, and in what usually would take me 15 to 20 minutes took me over an hour to be done, but I did it. And then I tried to do some cardio, but I did Zumba. I had to stop every couple of minutes because I just couldn't keep going. Besides being out of breath and exhausted, and my heart going above its normal range for exercise for me, I just couldn't keep going. But I got through the whole video. I didn't do all of it. Like I said, every couple of minutes I'd have to stop and walk around until I caught my breath again. Just trying to be safe. And, you know, you don't want to push your body too far when you're first getting back into exercises. So I don't want to injure myself. I already have knee pain, arthritis, or I had it in my right knee, but I think I'm getting it in my left knee, and it's probably from all the weight that I've gained. So that's another reason I'm trying to start exercising again. So I've got to get some of this weight off, because the heavier you are going into surgery, the more high risk you are. There's more complications. And since they're gonna be operating on my upper arm, he said they would probably have to take at least 10 lymph nodes out of my axillary area, which is armpit, which is, if he said if all those are clean, then he won't take any more, which is good, because when they take all those lymph nodes, you end up having to worry about lymphedema all the time, which is when your arm swells up to these ungodly sizes and you have to wear sleeves and go get compression therapy, and it's not fun. So anything I can do to prevent that from happening, I'm gonna do. He said he would only do the one side right now, which I was kind of expecting, but I wasn't really happy about. I wanted to get both of them just taken off at the same time. But his reasons made sense to me. I think he thought that I just wanted to get it taken off so that I didn't have to worry about breast cancer again, and that's maybe 10 to 20% of my reasoning. The other reason is that I don't want to walk around with one boob. I hate wearing bras, and in the summertime, it's going to suck next year because I'm going to have to. But he said maybe within a year, if everything's going okay, I can go back and have that again, the second one taken off. But he said I'd most likely have to have surgery again anyways to fix however the left side heals. So yay, more surgery. I wasn't real happy about that, but I understand his thinking. The longer surgery with taking both would be more complications, possibly. I would have to stay longer in the hospital, which he said that he thought that I'd probably be able to go home the same day, which shocked me. I never expected that. And he said he had done a single mastectomy on a 69-year-old the day before, and she went home the same day, and she's not even a nurse. I already know how to do the drains and everything, so that really made me feel a lot better, because with COVID going on, most of the hospitals are not letting anybody stay with you. And I already knew, being a nurse, how short-staffed the nurses are in all the hospitals, just because healthcare is a business now, and they won't pay for more nurses, which is stupid, because in the long run they'd end up saving money. But it is what it is. So I knew that they were going to be understaffed already, and then being overwhelmed with the pandemic, and it'll be flu season at that time. So I didn't want to have to be in the hospital any longer than needed. So I agreed the single mastectomy is we're going to go with for now. And like I said, it's going to be the week before Thanksgiving, barring any unforeseen complications with chemotherapy, which hopefully everything's going to go okay from now on. I have 3 more, so I can see the light at the end of the tunnel. And I will be happy to be done with chemotherapy. I think this is probably the worst part of it. The surgery, I mean, I know what to expect, but the chemotherapy, you just feel like crap all the time. It sucks so bad. So my hair has started growing back in a little bit. There's like these little wispy short hairs that are white that you can barely see. It looks like peach fuzz. And then there's like stubble looking hair that's darker coming in, but it's coming in different patches. So I'm on a Facebook group of people who have the same diagnosis as me, and they said that when their hair started growing in, they shaved it at least 2 or 3 times after the hair started coming in until it all started coming in the same place, just because it was so patchy and it just looked horrible. So that's probably what I'm gonna do. But I have to say I have enjoyed not having hair. You wouldn't think so, but my air is out in my car, and so I'm having to roll the windows down, and it's nice to not have to worry about your hair getting in your face. I've never had that before, so I've always had to like wear a hat or pull it back real tight, and even then the ponytail and little stray hairs will get out and get in your face when you're driving. But it's great now. I don't have to worry about it, but I am happy that my hair is going to start coming in before it gets really cold. So other than that, I can't think of anything else that's going on. I want to thank everybody that's brought food and has sent messages and cards. It really helps. It lifts me up, especially in these last few weeks when I've been really down. So my plan from now on, like I said, I'm going to try to increase my activity every day. Hopefully I'll be able to get to where I'm semi back in shape by the time the surgery is. My goal's just, like I said, to be as strong as I possibly can going into it so that my recovery will be better. So we'll see what happens. I'll try to give y'all updates more often now. I feel like I'm kind of over a hump. So anyways, I'm thinking of everybody. I miss y'all, and I'll see you later. Bye.